Good evening to you all. Today we are talking about the distribution of low density lipoprotein cholesterol. By way of introduction, cholesterol is a fatty substance which is essential to healthy life, and it is found mainly in the brain, nervous tissues, the skin, and the adrenal glands. As we know, it has very important function. For instance, it is necessary for cell wall or cell membrane function. It constitutes part of some important steroid compounds like aldosterone and estrogen, etc. And it is also important in the formation of bile acids for digestion. Actually, the liver is the main site for synthesis of cholesterol, and this is very important to note. LDL cholesterol and cardiovascular disease. Studies have shown already that high levels of low density cholesterol is associated with significant cardiovascular morbidity, such as coronary heart disease, atherosclerotic vascular disease, diabetes, and stroke. However, it is important to know that there are many types of lipoproteins. We have about 5, and we have the LDL, which is the bad cholesterol generally called, the HDL, which is a good cholesterol, and the others. And if you want to look at it, as you can see from the diagram, the LDL is in between the chylomicron or the VLDL and the HDL in terms of risk of cardiovascular morbidity. And it is important to know that the HDL is a potentially anti-inflammatory substance compared to the others, which have the propensity of being pro-inflammatory. This slide shows the composition of the various composition of the lipoproteins. We have triglycerol, cholesterol itself, phospholipids, and proteins. These 4 major substances constitute the lipoprotein, and it is important to know that there's evidence to show that atherosclerosis begins early in life, and that elevated lipid levels in adolescents could lead to prediction of high lipid levels into adulthood. And it is we can see that less than 100 milligram per deciliter of LDL cholesterol is acceptable, and the borderline is between 100 and 129, and definitely if you have 130 and more, it is considered high, and therefore the risk of developing cardiovascular morbidity is high. Also, we can see from this slide that there's a direct relationship between reduction in the levels of LDL cholesterol and the risk of developing major vascular events. And so by reducing it to, let's say, 33, reducing the LDL cholesterol level by 1.5 millimoles per liter could lead to about 33% relative risk reduction, and this is very important for us to know. This slide shows the it's a meta-analysis indicating the proportional effects on major cardiovascular events in relation to LDL cholesterol. And you can see that obviously there is benefits when patients are treated with statins. Statins are mainly anti-cholesterol drugs which can reduce LDL cholesterol significantly, and studies have shown that by using statins, it can reduce the level of LDL cholesterol and therefore reduce the risk of major cardiovascular events. And this is very important to know as well. So various studies were involved with this meta-analysis, and it has shown that obviously the use of statins in treatment of people with high levels of LDL will lead to significant improvement or protection against major cardiovascular events. Here we look at the distribution of LDL cholesterol in relation to age and gender, and we can see that below the ages of 30s or around 30 years and around that area, you see that cholesterol levels are low. I mean, compared to people who are around 40 years and above, they have the highest levels of high cholesterol. And then in the 50s, the levels drop a little compared to the 40s. And this is very important to know. In this case, it's important to remember where the sources of LDL cholesterol or cholesterol in general, which is mainly from the synthesis from the liver and also from diet that we get from. The next figure, which is close, also shows the distribution of high cholesterol levels in relation to gender, and studies have shown that male or men actually have high levels of cholesterol, and this is also important. It may be related to the development of cardiovascular morbidity and mortality in men. This graph, studies have also shown that there is in terms of relative risk of coronary heart disease, you can see that there is a direct relationship between the log scale of the relative risk of heart disease in relation as against LDL cholesterol, and this is also important to know. That means that as the levels of LDL cholesterol increases, then the risk or the relative risk for development of coronary heart disease also increases. And so it goes, this point has already been stated, and this is very important as well to remember that with an increase in the levels of LDL cholesterol, it definitely results in increased relative risk of developing coronary heart disease. This slide also shows a distribution, like the attributable risk factors for myocardial infarction, and we can see that in this case, lipid or cholesterol represent the highest level of risk factors for first myocardial infarction, and this is mainly from the INTERHEART study, which shows that followed apart from the cholesterol levels, smoking is the next important risk factor, and then psychosocial events and hypertension and alcohol, they are all mentioned in there. And it is important to look at some of these things as well in terms of predicting cardiovascular major cardiovascular morbidities and mortalities. Finally, studies have shown obviously that low levels of HDL cholesterol is related to high levels of LDL cholesterol, and all these are predictors for cardiovascular risk and also coronary heart disease. So in summary, we have talked about how coronary heart disease or cardiovascular events are associated with high levels of LDL cholesterol, and we have also mentioned some of the population, like men having high levels, and also age distribution in terms of low LDL cholesterol, and all this can be related to cardiovascular morbidity and mortality. Thank you for listening.